Welcome to The Bee's Knees, a podcast full of articles, interviews, clinical studies, and advice about knee surgery, physical therapy, and life after knee surgery.
All right, Nan, let's dive into this because, I've observed your story, but I don't know your story, really. I mean, Todd, your coach, has told me about it and how you got there, but nobody that's listening to this thing knows anything about you or how you ended up on the X10 and how you did and all that. So it's a discovery for me a little bit, but certainly for everybody listening. So however long you want. Well, first of all, hi, Nan. This is PJ. Say hi, Nan.
Hey, PJ.
Right. Got that started. Nan is in Massachusetts. I'm in Lower Manhattan. We're having a little chat for our Bee's Knees podcast. So just to set the stage, here we are on a Wednesday night having a little chat.
That's right, hump day.
Hump day. We're getting through it. So let's do that first little thing, which is tell us about you, your background, where you're from, what you're all about, that kind of thing.
Certainly. I'm 62 years old, and I grew up in Seattle, Washington, but I've been living in Cape Cod, Massachusetts for 30-plus years with my husband. We raised 3 children here, and I work at Woods Hole Oceanographic Institution as a research technician and have been there for about the same amount of time that we've lived in Cape Cod. It's been great. I love Cape Cod, Massachusetts.
What is it that you do? Can you describe that? Tell us more.
I'm a research technician. I work in a radiocarbon dating lab at Woods Hole Oceanographic Institution, and it's been a great job. And plus that, the institution provides wonderful health benefits, and so I was able to take advantage of that for the first time when I had my multiple surgeries. And I just realized how lucky I am to have been working there.
Wow.
And to be able to take advantage of that. Yeah, no, I've heard other podcasts where people, have a week off, 2 weeks off, which I couldn't even imagine. So,
right.
My journey's been a long one, but in terms of rehab, but only because I was able to because of my healthcare coverage. So I'm very fortunate.
All
Maybe
right.
not quite as fortunate if I lived in Michigan, and could have gotten coverage for the X10 insurance.
And so many of them, all of you Michiganders who are listening, please appreciate this thing, because a lot of them get it covered, right? Covered by Blue Cross Blue Shield.
Yes.
And many of them do not realize how lucky they are to just get it, to get the X10.
Yeah, no, they should realize it, because but in some ways, having to pay for the machine through rental really gave me incentive to use it. I mean, I was trying to break it down cost per minute of use on the machine.
That's interesting. Did you come to a number?
It provided a lot of incentive. So in a way, it helped me.
We talk about that a lot. We have weekly coaching calls with our team from Northeast Florida, Todd, all of our gang in Michigan. And, when you're, paying some amount of money for your recovery, you didn't expect to have to do that. And, but you decided to do it because it was going to be a big change in your recovery and all that stuff. You covet that experience and value it so differently. And we find in terms of just dedication, compliance, desire to succeed, that the folks that are renting it are the very best patients to work with from the coaching perspective.
Yeah, I think that might be true to a certain extent, but I think that the X10 provides its own motivation in many ways. It's just an awesome machine. I can't recommend it enough for anybody who's had knee surgery.
Oh, okay, we're done.
Time.
End of the podcast. That was great. Thanks.
You don't need to hear any more from me.
We're done. Yeah, that's all we need.
I'd be a good commercial for your machine.
Right. We just did it. The sound bite. Now, as I was saying to Nan before we jumped on the actual recording, the last thing I'm trying to do here is some sort of sales pitch. This is an open forum, I guess, between two people, but it's an opportunity to dive into what worked, what didn't, what were the obstacles, really paying it forward for the next knee patients. So let's
That's
get into
correct.
that.
And you're
Go
not
ahead.
paying me for this
No,
interview,
no,
so we can make that clear from the start. But
I'm too cheap.
so
Too
anyway,
cheap to
you
pay
want
you.
to hear a little more about my knee and
Well,
how
yeah,
I ended up in this position?
that's right. Let's do that. So go back to tell that story of your surgery, starting with the moment where you had that first inkling that
Where
you're
I
going to
had the
need to do
injury.
it. Yeah.
Well, I actually injured my knee like 41 years ago when I was a senior in college. It was a sports-related injury. I blew out my knee, meaning I completely tore my ACL and tore my cartilage. And they didn't realize the extent of the injury, and they didn't do surgery right away. And then, which is actually probably a good thing, because back in 78 when I did this, I'm dating myself now, but when I did this in 78, they did reconstructive knee surgery. You know, I don't know if you're familiar with what they used to do. The scar, I think, would run, I don't know, would be almost a foot long, running down the length of your leg on your
Wow.
knee. And
Wow.
the success rate, I think, was probably very low, 50 to 60% success rate, meaning that people would actually be able to do stuff after having that extensive knee surgery, and the recovery was very long. So I was lucky, I guess, in that I didn't have that surgery. I just had an arthroscopic surgery to clean up the cartilage, and back then, arthroscopic surgery was an inpatient in the hospital type of surgery. It was fairly new. And so it wasn't like an outpatient thing like they do now, which is very quick and easy to recover from. They put you under general anesthesia, and I mean, it was like a regular surgery. So that was back in 78. That was my first surgery. And
what was the sport, Nan? What were you playing that you? How did
I was
this
a
thing happen?
college intercollegiate gymnast.
Okay.
I was at University of Washington, and I competed for 4 years there. And my senior year is when I injured myself in a gymnastics meet. But so that kind of ended, obviously, my gymnastics career. And you know, it was interesting because there's nothing that could be done. The school was very nice, and they paid to have a custom-made knee brace for my knee that I could use. And so I just basically moved on with my life, and I did all kinds of things. You know, I continued doing sports because I love sports of all kinds, mostly sports that aren't good for your knees. And as a consequence, oh man, you're going to laugh. You can't laugh, okay?
I'm not going to laugh. No.
I tried rugby. I always thought that would be kind of cool.
Yeah.
And I played on the Boston women's rugby team for a part of the season until I re-injured my knee. And let's see, I ran, I skied, I biked, I hiked. And in the last 20 years, 15 years, I picked up martial arts.
No kidding. Which one?
Practiced that. Taekwondo, I did that for 7 years, and then I quit because it was so hard on my knees. And I decided I had to go back to the gym and get my knees strong again. And I got bored with that after, 10 years of doing that. And then I went back to the dojang, and I picked up a new another Korean martial art, Tang Soo Do. Tang Soo Do, yeah, it's a very close cousin of Taekwondo.
Mm-hmm.
They're both Korean martial arts. But anyway, I did that up until I had my surgeries. So, but in the meantime, I'd had numerous surgeries, arthroscopic surgeries to clean up my knee because I'd re-injured it doing all these silly sports that I probably should not have been doing. And just kind of coped with it. You know, I over time became more functional. My knee became less functional. And I was more limited in what I could do. And I finally, what was the straw that broke the camel's back was last winter. I went skiing with my daughter, and I fell, and I didn't hurt myself. I just was standing there, and I fell, but I couldn't get back up again. I couldn't get up off. I couldn't stand because I couldn't bend my hip, and my knee were so stiff I wasn't able to stand back up with skis on my feet from the ground.
Wow.
So my daughter, who's a physician, insisted that I go to see an orthopedic specialist, and she found an orthopedic specialist for me at Mass General Hospital, Dr. Kwan. And he was recommended to her through her other physician friends. And that's how I found my knee surgeon.
And did that turn into a quick conversation about replacement, or was it let's put it off as long as we can, or what was the nature of that?
Oh, no, there was no doubt.
Okay.
You know, my knee, I think the last 10 years my knee had gotten way worse. You know, it wasn't ever deformed up until, I don't know, it got pretty deformed after the past 5 years. I had a severe valgus knee, meaning it was, that's a severe knock knee.
Right.
You know, you have different levels of deformity, and mine was pretty severe. I think I had a 30% valgus bend, so I was pretty knock-kneed on that one knee. My left knee's fine. My right knee is the bad one. So there was no question that I needed surgery. I just always thought it was best to keep my natural knee as long as possible. But there's a downside to that. I mean, I got a lot of use out of this bad knee, but the collateral damage were my hips. I developed arthritis, severe arthritis in both hips. So when I went up to see him, it was with the understanding that I said, okay, I think I'm probably going to have knee surgery. And it ended up, I said, you know what, you might want to x-ray my hips as well, because my hips are really bothering me. And he did that, and I have severe arthritis in both my right and left hip. And Dr. Kwan said, we got to start at the top and go down, meaning my hip had to be done before my knee. So I'm just glad that he didn't do x-rays above my hip.
Oh, yeah, right. Yeah. Elbows and shoulders and good Lord, yeah.
Yeah, exactly. So, yeah, I guess that was a good thing. But anyway, so that's what happened. I ended up having my right hip replaced in mid-May, and then recovered from that as best I could. And then
how was that, by the way? What was that journey like? Was it
the hip recovery?
Yeah.
Hips are fairly easy. You know, the pain I experienced wasn't nearly what I had with my knee. And I was only out of work for 3 weeks. Then I went back to work half time, and then I was able to go back to full time pretty quickly. But the problem, my knee certainly, or my hip certainly wasn't recovered before I did my knee surgery in August. And I think, well, my hip is still recovering now to this day, and it's been, 9 months?
Yeah.
I think that's since May. That's
almost
around
10.
9 months.
Yeah, yeah.
And so I had a real regression in my hip after I had my knee done. So, you know, I've been doing extensive PT for both my hip and my knee for the past.
Why
9
so
months.
soon afterwards? May to August? Was it just, you know? You could have waited a little longer, or was it just that bad?
Well, I suppose I could have waited longer. It was what the surgeon recommended. And I think that my knee was so bad, I think he wanted to get that taken care of as soon as possible.
Okay.
The longer you wait with these situations, I think the harder it is to correct, and my knee was it was pretty bad. So, and also, who knows if I had waited, you know, maybe a year, because they say it really takes a year to recover from both hip and knee surgery, that the impact of my bad knee might have had on my new hip.
I see. Yeah.
I listened to what the surgeon said, and I went forward. My physical therapist was skeptical. He said, you might want to wait a little longer to think about it. And I discussed that with the surgeon, and the surgeon insisted that, no, this would be fine. So
did you build much of a, sounds like you found a physical therapist. That's great that you trust and like along the way.
Oh, yeah. I've been going to this physical therapist over the years. I've been in and out of physical therapy for my knee for years.
Right.
And I'd already established a bit of relationship with this physical therapy office. And, it was great. There's no doubt this physical therapy office is awesome.
What's the name of the practice?
It's Falmouth Sports Center Physical Therapy. Okay. It's right in Falmouth, where I live. And they're just an amazing group of people. And
That's
they've
great.
been very supportive through this whole journey. And, it's been they make it fun, believe it or not.
That's great.
As fun as physical therapy can be, right?
Right. Pain and torture. Not in your case. That's great.
Yeah.
Oh. What's great is that through all this activity, though, the right knee obviously got the worst of it, but it sounds like the left knee is still okay, and the left hip, those are in decent shape at this point?
Well, the surgeon had said that I will need surgery on my left hip at some point. But I think I'm kind of done with surgeries for now. My left hip feels pretty good relative to my right side.
Right.
I think I'm just, I think unless it really gets bad and I can't see at this point, I'm still struggling with pain in my hip and my knee. So, I think I'm going to wait.
Right.
I don't think I want to rush into this anytime
soon. Summer off.
Exactly.
So you find Dr. Kwan. What was the date of the knee surgery?
August 30th.
30th.
Isn't that funny how these dates kind of stick in your head?
Yeah. Well, they're momentous. They're marriage dates and birthdays. It's a big deal.
I remember my knee surgery better than my date of my anniversary, but don't tell my husband that.
No, he'll never hear this. He'll never know. And we promise as audience members never to tell him. All right. So August 30th, you do it's total knee replacement. Anything to say about the surgery, the hospital, the device? Was there anything notable there that struck you as interesting about going through the actual surgery?
The Mass General Hospital is an awesome hospital. I had my hip done there as well. The staff there is very professional. They're great. The nursing staff is awesome. And that's one of the reasons why I think that this doctor is rated so well, is because of all the support staff, and the hospital itself is just great. In terms of the experience itself, the surgery, both surgeries went well. The one thing that I learned from my knee surgery is I didn't understand the extent of the pain that I would have, because my hip surgery, I didn't take any meds at all. No meds for that at all. I might have taken some Tylenol, but that was it. And so I thought I could tough out my knee. And when you have a block that blocks the pain, you don't understand how much pain you're in until the block wears off.
Right.
And what they always say is you need to stay ahead of your pain.
Right.
And I didn't understand what they meant, but it really is true. I mean, I think the thing I learned is the one thing that the hospital did not do, I think that they could have done a better job, was informing what this was going to be like once the block wore off. And I just had no clue. As I said, my hip experience was different.
Day 2, day 3 post-surgery?
No, let's see. I had the surgery on the 30th, and I was released within 24 hours. I was out of there by the next day. They sent me home. I could go home.
So while you're in the hospital, you could have managed pain a little bit better on site.
Well, they do that for you. You don't have to think about anything. They do everything for you. They routinely give you your pills.
Right.
I was on tramadol, I think, which was great. But when I left the hospital, it was up to me to take these things, and it wasn't drilled into me upon leaving that, look, for the first couple of days you should probably be taking this at a regular interval. They just kind of hand it to you and say, okay, you can use these if you need it.
Right.
But yeah, and so it's kind of it was a learning experience. If God forbid I ever have to do something like that again, I will definitely know how to handle it better. And then I had a pretty bad reaction to the oxycodone. I'd had it before, and I usually very rarely take those type of medications, and it made me very, very sick. I was pretty nauseous, and so I quit taking that as quickly as I could, and I didn't even want to take it for physical therapy because it made me nauseous. And then the physical therapist said, well, you got to take something in order to get through your in-home PT. And he said, well, you call the doctor. And so I called up my doctor, and they prescribed me tramadol, and that was way better.
Yeah.
So that was a good drug to be on. But I tried not using it unless I absolutely had to.
I mean, I've had sat in a lot of audiences, hearing surgeons and everybody talk about this stuff, and we had a chat recently by a guy who really believes in CBD, there are a lot of opportunities there to not take the big heavy drugs and get through this, and it depends on the person and what direction they want to go in, because it really is a surgery that requires real coverage. You've really got to mask that pain so you can do PT as you found.
Yeah,
so
I
now
found that out.
Go ahead. Sorry.
I was just going to say that not to scare people off, but everybody hears how hard PT is. It's really hard, and I mean, there's no two ways about it. I would take the drugs before going, and it didn't matter if I had the drugs or not. It still really hurt. So I basically quit taking the drugs because I said, oh, man, this is going to hurt no matter what.
No matter what.
So, what sense is there me taking this if it's going to hurt anyway? So, but, surprisingly enough, the pain is always worth it. You got to get through that pain in order to make gains.
So what
no pain,
happened
no
here?
Gain is true.
What happened here? Tell me. It's now early September. Did you have any home therapy for a few weeks?
I did. I had a physical therapist who I met through my hip surgery. He worked for the VNA. He was awesome. I really loved him. And he came and did my knee. I requested him, and he came back. And I was fortunate enough to get him again. And I worked with him for probably 2 weeks.
Okay.
And then I was supposed to be released to outside PT, but I developed an infection in my wound, and the doctor did not want me going to the outside physical therapy until the course of antibiotics had kicked in. So it was a month from surgery before the end of September before I made it into the outside physical therapy. I did in-home stuff on my own. I did all my in-home exercises. So
it was a superficial infection.
It was nothing major. Incision? It was just superficial, just on the wound. Yeah, but it required antibiotics I had to be on, so they didn't want me going outside with. So
alarm bells are ringing. I just wrote a blog that I published yesterday about infection. But alarm bells are ringing because you're losing some PT time. I know you enough on this call to know that you were doing the homework, you were doing the home PT on your own, even if you didn't have the awesome VNA guy, but you were falling behind a little bit because of that superficial infection, I think.
Yep, put me behind a couple weeks.
Yeah, right.
I guess if that's how you want to look at it. But I think that it's pretty interesting. My range of motion wasn't great going into this, into the surgery. And once everybody found out about that, they weren't so concerned about my range of motion.
Right.
And the fact, my lack of range of motion.
Right.
And, I basically was struggling in my physical therapy, outside physical therapy for months. I'm serious that I do it diligently 3 times a week. And they'd stretch me. They had me on the table. It was extremely painful. Some poor other physical therapy patients said that they don't think that they ever want to have knee surgery after seeing what I was going through. But, I basically couldn't get more flexion. On a good day was 107 degrees.
Okay.
And that was months. I mean, I went back for my follow-up visit with Dr. Kwan January 9th. So that's about 4 months, just over, what is that? September, October, November, December, 4 months.
Yeah.
Plus a week or two.
Sure.
Following my surgery, and I only had 107 degrees flexion. I had 0 degrees in extension. That was never the issue. It was the flexion.
And
so
along
that was
the way, yeah, I'm sure there was never a conversation about manipulating under anesthesia, that kind of thing?
No, I wasn't a candidate for it for one reason or another.
Okay.
I talked to my physical therapist about it. I called the doctor, and they weren't keen on doing it.
Okay.
And I think it was because their perceived notion of my lack of
pre-surgery range of motion.
Pre-surgery, exactly.
Yeah, yeah. What was it? Do you have a number, or you just know it wasn't great?
That's interesting. No, I don't have a number.
Right.
I wish I did, but I can tell you that there's a benchmark for me. I don't know if I should tell this in an interview, but I'm 4'9.5", so I'm fairly short. And there's certain things that I could do with my leg and my bend before surgery that I could not do after surgery. So, and I still wasn't able to do that. One of them was cutting my toenails over the toilet seat. I couldn't do that afterwards, and I could do that easily beforehand. So I know that, it's a function probably of the range of motion also in my hip.
Right.
Not
that's
just
a
my
good
knee,
point.
but both my hip and my knee.
Right. Right. Your whole mechanics are different now suddenly with the knee and the hip all on the right side.
Exactly.
Yeah.
Exactly. And that's the other thing too, is that it took me months, literally months, for my body to finally figure out that my knee was straight. So from a neurological point of view, my knee had been bent for so long that my brain still thought that my knee was bent. This is how the physical therapist put it. My daughter's a neurologist, and she was trying to explain the same thing to me. I had to form new neural pathways in that knee to try and so that everything is realigned now, so it's different. And so, I could see it was different, it was straight, but my brain still wasn't picking up on it. And it literally took months to make that connection. And now, I try to do positive thinking, my knee is straight, my knee is straight. that didn't work, it just took time.
Did this manifest
maybe it was partly the positive thinking, I don't know.
Well, yeah, no, I'm all in on that, truly. But did it manifest itself in a gait that was off that didn't have to be off, or like how did this now new straight knee, how did that impact the way you're walking?
Well, that's a really good question. It had to do more with stability. My knee, I had to use, I was using a crutch or a cane as an aid up through December. So that was
a long time.
September, October, November.
Yeah.
For 4 months, I was using an aid. I couldn't walk comfortably without my knee buckling or feeling like it was going to collapse inward, without either using a cane or a crutch. So it took months for that to happen.
So I want to underline
that. Once it happened, it was great.
I want to underline that, Nan, because there are a lot of other people that have a valgus condition, whether it's 30% or 20 or whatever, and they may not be thinking that that's going to be an issue because, oh, gee, my knee is straight, all should be fine. But that adjustment to straight, back to what we consider standard, normal, alignment, that's a recovery unto itself. It sounds like.
It really is, and the other thing to think about too, that I learned, is that your body adapts over time very slowly to this deformity. It doesn't happen overnight. You don't wake up one morning unless you have a severe injury. This was due to arthritis. You develop the bone on bone, you develop these bone spurs, and pretty soon you get this deformity. And it changes over a long period or a short period of time. It changes over a period of time is the point. And in doing so, your muscles, your ligaments, everything in your leg is changing as well. So now all of a sudden you've had this surgery, they've removed that knock-kneed bend in your leg and they straightened it, but now you've got all these other connections in your leg that you need to work on. I mean, they just don't automatically stretch again.
Right.
So when I was using the X10 for flexion, I had a bunch of issues with my IT band. Was very tight. And that's probably as a result of having, this deformed knee over a period of time. And it took some doing to loosen it up in order so that I could get my knee to bend more. So there's all these things happening when you have these deformities.
Yeah.
Because your body adapts to it, and you can't. It's not going to change overnight. It takes a long time to work the kinks out, so to speak, I think. And that's, I think, what happened with me, and why the X10 machine works so well for me is because, going into a physical therapy office and getting this stretch 3 times a week was not enough. And they'd stretch me for 5-10 minutes max, and that wasn't enough. I needed to do a persistent, everyday, 3 times a day, everyday stretch in order to get these things to loosen up.
Right.
And that, I think, is the beauty of this machine, is that you're allowed to do that. That's something you can achieve that you can't get in a physical therapy office.
The time without with you being in control. Well, let's get to that point then. I want to hear. Let's go back to January 107. You're sitting there with Dr. Kwan. What was that conversation like? What was the direction that you guys were headed in? January 9th after you had that meeting. I mean, he wasn't happy, but he was acknowledging that it was a lot of other factors, I guess, right?
Well, actually, no. I think he was quite satisfied with my surgery, and that's another interesting point I wanted to bring up with you, is that I think that he thought his job was done. The question wasn't, are you satisfied with what you've accomplished so far in physical therapy? His concern was that I can walk, number one. Number two, that my leg was straight. So he achieved his goals.
Right.
His goal was purely mechanical, was to replace my bad knee, straighten it out, which he accomplished, which actually is not an easy thing to do.
Yeah.
He actually specializes in working with these kind of severe deformities of the joint. And so I really commend the fact that he he accomplished that. But what I've discovered is that there's a real disconnect, I think, between what their goal, the surgeon's goal is, the doctor's goal is, and perhaps what the patient's goal is. Maybe in this case, I can't speak for all surgeons, but in this case, my surgeon was mostly interested in that he had accomplished his goal of the mechanical part. He fixed the mechanical part of my knee. Now, the functionality of my knee, in terms of, from my perspective, was different. I didn't have the flexion I needed to even walk downstairs. For some people, what's the degrees that you need? 110 to be able to walk downstairs easily?
I've heard lower numbers than that. I've heard 105 is a benchmark for going down, a lower number for going up. But
if you think about it, it makes a difference on your size, right? Because stairs are somewhat standard in terms of height.
Yeah.
And since I've got kind of a short stature, I have to bend my knee more than
that's a good point.
6 foot tall person won't have to bend their knee as much coming down the stairs as I do because I'm so short. But anyway, going downstairs was uncomfortable.
I see.
It hurt. And, I also am really interested in participating in sports again. I want to go hiking. I want to be able to ride my bike, and I couldn't ride a bike. I couldn't bend my leg enough to pedal.
No, not 107, certainly. Yeah.
Yeah, so did I accomplish my goals? Of course not. No, I was nowhere near it. And so it was pretty frustrating, actually. He was quite pleased with himself. And
I can see it. Okay, great, we're all good. Like, wait a minute.
Yeah, no, I mean, it was pretty interesting. PJ, that I walked into the office, his little room, where he was seeing me, and he was standing in the hallway with another surgeon. And I had my gym shorts on because I wanted to show him my knee. And so I had my gym shorts on, and I came walking up, and these two surgeons were staring at me like I had no clothes on. They were looking at but they were staring at my knee.
I see.
They were both so excited to see
oogling. They're
how
oogling
straight my leg was.
Hey, look at those sexy pins. Look at this lady.
Yeah, no, exactly. They were just so excited. It was pretty funny.
That's cool.
I got a kick out of that. But, so I said, okay, this isn't good enough for me. I would need more bend. Do you have suggestions? And so he basically said, put your leg up on a stool or step and bend it. And do that 3 times a day and increase that a degree a day. And then by the end of the week, you'll have 7 degrees more. And I just said, well, wait a minute. What do you think I've been doing in physical therapy for the past 4 months? I said, nothing has worked. And he goes, no, I guarantee this will work. Well, okay. I went home and I was diligent about it. I tried it. And I went into my physical therapy appointment. And you always get measured. I always make sure I get measured.
Good for you. Yeah.
And I got measured, and 3 days later, 107 degrees, hard and fast. And so, it was pretty.
Well, the thing is, he's not wrong, is he? It's just it's really hard to do that. I mean, if you could be exactly 107, and but I think that's where the machine starts to step in, and that it's going to give you a amount of time, an exact measurement, a controlled advance to 108, 109. I mean, it's a program versus go lean on a stool and see what you can do. I spend a lot of time.
And there's
on the
no
phone with people.
guesswork on it. It's very measured.
Yeah.
And it's a very controlled, measured way to go about doing this therapy.
Well, let's talk about how you got there. Like, how did you? It's kind of an interesting story, but how did you get on the X10? It's kind of a cool story.
Yeah, no, this was kind of interesting. A girlfriend of mine had knee replacement 2 months after me on October 31st, and she had gone online and looked at, done some research on her own because she had some issues with flexion as well shortly after surgery, and she's really nervous about it. So I think she got the X10, and then I think at 3 weeks' time, she had an MUA because she was only getting to like, I don't know, 98, 99 degrees.
Mm-hmm.
So they went in and they did the MUA, and she came out. She started using she used the X10 before going in, and then she used it immediately after her MUA.
Yep.
And she achieved 130 degrees in short order. She's amazing.
Yeah, I remember that because we did a little bit before, and we do that sometimes where we're like, we don't know if we can avoid the MUA. Let's try, and if we can't, go get one, come back, and we'll get you right.
She was very hesitant about doing it, but then her surgeon said, okay, we need to do this. And so they did it, and she was so glad that she had done it. She's it was amazing. I was a little jealous, of course. She was doing all this, and she achieved all this. And, of course, I'm still at 107, and she's already gotten to 130. And so she's ready to give up the machine. And she said, Nan, you got to come over and take a look at this machine, seriously. And I said, well, okay. I was really still pretty reluctant. And so I went over and looked at it, and it happened to be, and Todd called her that day and said, I'm coming to pick it up. And she said, well, I think I have somebody else that might want to use it. And he goes, oh, no problem. So we brought it over to the house, and he outfitted me for it. And it was quite a bit of doing because I'm so short that, we had to use 2x4s, and, we had to do a lot of rigging. We had to rig it up for me to fit.
Right.
But it was amazing. I think I got it like on the 15th or 16th. I used it a little bit that night, and then I started in earnest using it the next day, 3 times a day. And let's see, I think that was a Wednesday, and then I always have my physical therapy appointments on Thursday, Mondays and Thursdays. And I went into PT. I did 5 sessions on the X10. I did 3 on the first day, that Wednesday, and then I was getting up at 5 o'clock in the morning so I could do it an hour before I went to work, and then I'd come home after working half time, come home, do the machine for another hour, and then I'd go to PT. And then I got measured after 5 sessions on that Thursday, and I was 112 degrees.
And you know what I love about that?
Huh?
You know what I love about that? Is it's not like, oh, the X10 has different measurements, and the X10's its own. You got measured at PT where you'd been at 107 for the longest time. I love that. I love that.
Yeah,
because, everyone measures a little differently, and, numbers are a little funny. But, these are the same measurements you've been seeing for 4 months, and boom, 5 degrees. It's amazing. It's amazing.
Yeah, no, it was pretty amazing. I was so excited. And, it's interesting. You're going to have plateaus. I'd get measured. As I said, I was doing, I think at that time I was back to work half time. So I was just going to PT from 3 days a week. I dropped down to 2, Mondays and Thursdays, and I get measured each time. I'm looking at I kept a record of it. And that first time I measured 112, the next time I measured 111, and then the following week I measured 115. So the second week using the X10, I got up to 115.
Right.
And then you plateau out. I plateaued. I go up a little bit, go down a little bit. It's never going to remain the same, but in general, the trend was upwards in terms of getting more flexion. So I ended up using the X10 for 6 weeks.
Was it that long? Weeks. It might have been that long, yeah.
Yeah, I think I had it for 6 weeks. The final week, I dropped down from 3 days a week, 3 times a day to twice a day. The 5th week, I was just doing it 2 times a day. And then what was I doing? Measuring on the X10, I was up to around 124, 125 degrees.
Amazing.
But I was never able to get quite there
to 130. Oh, to be
No,
in
never.
PT, so
Not
yeah.
even getting close to 130.
No.
I'm not even gonna. I was actually kind of worried about doing that because the max flexion that they gave me and post, in surgery they'll do a gravity. Well, my surgeon did a gravity bend of my leg, so it
Right.
wasn't a force bend. They just like gravity bend my leg, and they measured me at 120.
Mm-hmm.
So my concern was, how far can I push this
Right.
this fake knee, my new
Right.
knee.
Yeah.
So, and I talked to my physical therapist about that, and he goes, well, you should be careful about doing this, but why don't you just see how it feels? And so I quit using. I was down to once a week at 6 weeks, or once a day at
Right.
6 weeks, but I was
Right.
spending like 70 minutes, 70, and I was spending, I'd say, 50 minutes of that time at least I was spending at the higher range. So I'd spend a huge amount of time, 122, 23, 24, 25, and then I'd pyramid back down, just to make sure. I was so fearful I was going to lose everything I gained
Right.
by giving up the machine.
Yeah, I know that was a fear.
Yeah, no, I had to think of ways to try and adapt and trying to loosen up my knee and worries about how do I maintain this. Long
Mm-hmm.
discussions with my physical therapist. And he goes, you got to wean yourself off this machine, which was true.
Yeah.
Right? You can't keep it forever.
Right.
And he felt like I'd gotten as much gain from the machine as I could get. He goes,
sure.
We didn't even think you were going to get to 115, Dan. You're at now, I measured 125 degrees in physical therapy, and he goes, that's a huge gain. That's a huge difference. And we didn't even think you'd get to 115. So he goes, the important thing now is you got to think of other ways to naturally stretch the knee without the machine.
Yeah.
So I've been doing that. And guess what? I haven't had the machine for a week and a half.
Yeah.
I think week and a half after using it daily, first 3 times a day, twice a day, and then once a day. And I measured on Monday in physical therapy. I measured 126 degrees.
That's 2 days ago. 3 days? 2 days ago.
2 days ago.
2 days ago. Yeah.
So that for me is huge.
Wow. Right.
It's not 130. That's okay. I'm really happy I'm where I am. It could have gotten there though without the machine. And more than that, it's not the degrees I have. It's the feeling of I don't know, what is it? Elasticity or looseness of my knee, whereas before
Freedom
it was so
of
tight.
Movement. Yeah.
Yes. So the way the physical therapist would say is before at 107 we were reaching your end point. We couldn't stretch you anymore. We could feel it stuck. It was just like stuck. There was no give to your knee at all. But now they can push me, and there's still some give. They're bending me a lot more than they were at 107.
Mm-hmm.
So there's no longer that end point. I'm sure there would be an end point, probably my screaming. But there's now this looseness in my knee that I never had before, and that's because of all the stretching I did.
The time, my goodness, the time per day, even though it declined over the weeks, the amount of stretching you got, just your body, I don't want to use the word gave up, but gave in. It relented. It allowed this to happen without trauma, without new swelling, without anxiety, all the things that usually go on with, take a deep breath, let's bend this thing, Nan. And, suddenly it's little bits and pieces along the way is how you did it.
Yeah, no, I think that was the key. And every patient's different, the type of traditional physical therapy that people do work for some people, right?
Sure.
I mean, that's the reason why they continue doing it, I guess. But there's going to be some percent of population that traditional method doesn't work.
Yeah.
So, and I happen to fall in that group.
Right.
And so I was fortunate enough to find this where it allowed me to do this very controlled, very steady stretching and over a period of time. And that's basically what it was required. Now, I'm only a week and a half out from using it, and my knee still feels pretty good, so I'm pretty hopeful that I will be able to retain that.
It's not supposed to be doable, really, what you did. That's why I'm so interested in your story, because you read about 1 month, 3 months, like there are certain peaks that traditionally you're not going to get much more flexion past 3 months. Conventional wisdom, I guess, is what I'm trying to say. But we've been
that's
throwing,
what I was told too.
and we're throwing a lot of the conventional wisdom out. But it's your story, Nan. Really, it's you telling us this story right now that starts to pave the way for expectations. I had a call 2 days ago from a woman in Maine, and she's thinking about the X10, and she's 5 months post-surgery. And I'm so careful in my conversation with anyone that far out because I don't want to set expectations really high. I worry a lot. All the conventional wisdom says, no, you're kind of stuck with what you got. Don't have, big expectations. And yeah, it took you 6 weeks. Okay, let's just say that. That was a lot of work, but you did prove everybody wrong that you could get to 125, now 126. That's new news for, the world of traditional physical therapy, really.
Yeah, no, my physical therapists are astounded. They are totally astounded that I was able to do this. And I mean, they're marvelous people. They really are. They were supportive. They never said, "No, Nan, I think you're beyond the time. You're past the benchmark now." And I don't think that it's very rare for somebody to ever achieve any more flexion after this period of time. I mean, they might have alluded to it, but I ignored it. And so they were supportive, though. They said, okay, this is your knee. You've got to do what you think is best for it. Because I go in and I told them all about this, and I was so excited. And a couple of them came over and looked at it, and I mean, they thought it was great. I mean, they really did. And what's interesting to me too is that one of my physical therapists said, well, 75% of the people that come through here seem to respond to traditional physical therapy. But I started thinking about that. That may be true. They may respond to traditional physical therapy, but they may be told what I was told, that, okay, you're not going to get any more than 107, 110, 115 degrees. You're just going to have to live with it. And how many people actually just accept that? I bet you there's a large percent of people that just say, oh, okay, I guess this is the way it's going to be. I guess I just have to live with it. Whereas, I don't think it has to be that way. I mean, this is an alternative for people who can achieve what they need to or what they want to through traditional physical therapy.
What's your ethnic background, Nan? What stock? What country is where's your family from?
I'm Japanese American. My grandparents immigrated here from Japan on both sides of the family.
This is a story about I'm so glad to hear about how well the X10 did. This is a story about you. I mean, you didn't accept 107. This is a testament to your 6 weeks, and I'm not kidding. I mean, you made this happen. You could have accepted it. You could have. I mean, you were told by more than a few people that let's maybe take what we got and live with it. And this is about a testament to your stick-to-itiveness. And
well,
I really
you.
mean that.
I guess some people would call that sheer stubbornness. I don't know. That's what
yeah. Well, it's kind of the same thing, isn't it? In a lot of ways.
Yeah, I guess
you didn't take
you can
no
call
for an
it what
answer.
you want. Perseverance. I mean,
You're
that's
an athlete.
that's really
You're an
nice.
athlete, but it's true. It's true. I mean, this is a story about you just not taking no for an answer, and that's a sign of success and accomplishment. Those are the people that make big things happen in this world. It's amazing.
Well, thank you,
It's
PJ. You're
amazing.
making me feel better. You just keep talking.
Yeah, right. Yeah. No, I mean it. I mean it. I'm not kidding. And you're not the only person. And but it's you've proven a lot of people wrong. You've accomplished a lot. And back to your point, I didn't mean to take us so far from what you were saying, which was that people say, yeah, 110's probably fine. I can kind of ride a bike, and it's a knee replacement, for goodness sake. I'm just glad to have the pain gone. And
right.
But it's setting expectations. The expectations have been set. The bar has been drawn maybe lower than it should be, and I'm hoping that this machine and the people that work with the machine and the patients that use the machine, we can all raise those expectations and not take 110 and done for an answer, but take 125, 126, 130 as the answer, as our expectation. I want to set the bar there. And you're proving that we can.
I agree.
You're proving it. With what you've done.
I agree with
5
you. And
months post-surgery. 5. It's amazing. It's amazing.
Well, thank you. Let's hope I can call me in another couple months and check in with me, okay? Check to see if I'm riding that bike or if I'm back to doing my martial arts yet. I'm hoping to get back to it in another couple months.
Oh, I love that. I love that. I didn't want to step all over your words. I didn't, but it's exciting to hear what you accomplished.
Well, thank you.
Did we get it all in, or did we miss some things here? We probably did. We've been here. It's been an hour, everybody. We've all been doing this for an hour. It's amazing. We have nobody listening anymore.
Has an hour gone by already?
They're all gone.
Pretty hard to believe.
Listening. It's just you and me.
I don't blame them at all, actually.
I know. My goodness. But did we cover...
It's not you, it's me.
Oh,
but I appreciate you giving me an opportunity to talk about this. And as I said, I'm doing what I can to spread the news.
Thank you. Well, we're going to reach out to the surgeons and the PTs, and we're now outbound in our communication, and we're all, so we're spreading the word. You're helping us. You're giving advice to the next person. I don't know. Is there anything else you would want to tell that person that's looking at their 5 months post-surgery and not feeling great about it?
And not to give up, just to keep moving forward, that this is a snapshot in time relative to how much time you're going to have with the new knee. So, I'm only 62. I'm hoping to have this knee until I'm gone. Who knows when that's going to be, 80, 90. But I don't want to be restricted for the next 20, 30 years because of what I didn't do.
Right. When
5
you could.
months, 4 months, 6 months when I could have done something.
You had the
about
chance, right?
Yes. Now's the chance to do it. You got to strike while the iron's hot. It may be 5 months out, it may be 4 months, it may be 6 months or 7 months, but I think that you can do it. I think I showed that at least I could, and given my circumstances, having 2 surgeries, hip and knee, and then having to recover from that, and then recover also from extensive surgery on a bad knee. And I think it's possible.
Yeah.
So
yeah,
I think the main thing is that people can't give up. It can be discouraging. I'm not going to tell you that there weren't times when I was pretty discouraged and thinking, is this worth it? But in the end, it is. So I'm very glad I stuck with it, and I'm going to hopefully continue. And then if you talk to me another couple months, maybe I'll be doing all these activities that I'm working so hard to do.
Get the couple more weeks of winter done, and I think you're going to be there.
Get rid of the snow.
Yeah. Nan, thanks so much. Again, kudos to you. My thanks for your time here, and I think we're all excited for you, and thanks for doing the interview. Really wonderful.
Well, thank you, PJ. I appreciate it.
I'm Dr. Justin Trosclair, host of 2-time Podcast Awards nominated A Doctor's Perspective podcast. I interview doctors in and out of my profession about their specialties and the occasional non-doctor special guests. But we also go behind the curtain and see what's working for their marketing, overcoming struggles, practical knowledge, book choices, and relationship advice. Join me on any podcast app on your phone or visit adoctorsperspective.net for the show notes pages and free resources. I want you to have an abundant home life as well as a thriving practice. So come on, take a listen.
To learn more, visit x10therapy.com, 1-855-910-5633. Just a reminder, it's a huge help if you subscribe to, rate, and review our podcast. It helps people find us.
X10, back to full strength.